Basically, back in January, in the middle, we realized that this event was unfolding in China and it was starting to expand throughout the world. And so we started actually tracking it. And towards the end of January, we actually sent a memo to the police department and the fire department. Because of previous exposures with planning related to Ebola, H1N1, and things like that, we figured, especially with how prepared we were for Ebola here, we figured we would at least let our responders know what to expect, talk about travel advisories because we had a lot of travel advisories with Ebola. And so on January 26th, we sent a memo out to all of the staff talking about signs and symptoms and things to keep in mind for that. On the 28th of January, an email was sent out by the health commissioner from BDH talking about COVID-19, though that's not what it was called at the time, and talking about the fact that there were actually 3 patients in Virginia that were currently under investigation for the possibility of having that. As we were moving towards February, we have once a quarter an emergency management task force meeting with the city of Harrisonburg and Rockingham County. It includes representatives from the local government, from first responders, including fire and police. We have representatives from JMU, the city schools, the county schools, Eastern Mennonite University, Bridgewater College, the health department, the hospital, and several local industrial leaders, because this committee also serves as the LEPC for both the city and the county. That meeting was actually on February 13th, and we actually asked Dr. Cornegay to come to that meeting and specifically talk about COVID-19, and in fact, it had just gotten its name either the day before or that morning. And she basically presented what was currently going on and what we needed to do to be prepared for it. Once we got that presentation and had a better understanding, the one thing that we did is, as a city and county, we have a joint emergency operations plan. And if you can go to the next slide. Basically, by February 26th, February 27th, we had updated that emergency operations plan specifically for our biological responses. And the biggest change, actually, because we already had everything really in place, was we changed some wording because prior to this, the health department locally was our primary lead for biologic responses. But really, there's been a change within the health district on how that was organized, and so we needed to change some terminology, which put the health district instead of the local health department in that lead role, just to clarify and make sure we had the right phone numbers. Starting on March 8th, as we were tracking cases here in Virginia, we opened up our own virtual EOC for the city, keeping track of numbers as they occurred throughout the state of Virginia, and keeping up to date with what we were doing in the city related to plans. We started to track within that week everything that was going on, and we actually started having, within the city leadership, 2 meetings a week on Tuesdays and Thursdays, talking about where we were with COVID-19, where we were with city operations, and you can actually go to the next slide. So basically, starting that week of March 9th, we started talking about where we were with schools, what JMU was going to do, specifically because JMU was coming back from spring break. And we started making plans on how we were going to deal with this as a city, how JMU was going to deal with it, how city schools were going to deal with it. And the afternoon of March 12th actually started to move very, very fast, unbeknownst of how everything was going to unfold that day. Basically what happened was, based on things that were going on in the area, the city and county fire departments, EMS agencies, and the Harrisonburg-Rockingham Emergency Communication Center decided to initiate our high-risk isolation protocol. And what that meant was we were actually going to start to screen 911 callers to see if they met the criteria for COVID-19. And if they did, we would change our response by the PPE that we wore to the facilities. And it would look a lot like what you've seen related to photographs from New York City and New Jersey. Is, we would have an N95 mask on, we would have eye protection, we'd have a gown and gloves on. And we implemented that policy. We started training our staff at 3 o'clock that afternoon. And the 911 center implemented the protocol at 4 o'clock that afternoon and started screening 911 calls. What we did not realize is at 4:30, we would actually get notified of the first COVID-19 positive patient here in the city of Harrisonburg. So it actually worked out fairly well because we had all that already initiated when we got the phone call. The Central Shenandoah Health District contacted us that afternoon. We'd also had a sort of a preemptive notification before that, but they called us and said, hey, we do have your first positive case here in the city. And actually, we talked about a communications plan that it actually occurred in about 15, 20 minutes to get the word out that there was a case here in the city of Harrisonburg. And we wanted to make sure, because of the lateness in the day, that we were able to hit the news cycle based on how that works. So we put a press release out to notify the city that, you know, there was a case. The health district was actually dealing with that, and we already had plans in place on how we were going to do with it, handle it. On March 14th, the city manager declared a local emergency. This was basically designed, one, to allow us, if need be, to use emergency procurement processes in case we needed to purchase large amounts of PPE or things like that that may not go around our normal processes, but it also allows us to easier meld with the state of Virginia and the federal government related to their declarations in getting reimbursement for what we were doing. Next slide. On March 16th through the 20th, we started to close public facilities. We started to close down programs through Parks and Recreation. The public safety building became closed for the most part to the general public. People were still able to come in and do services that they needed to, but they often were questioned before they came in, so we could decrease the amount of time they were in the lobby. We could take them directly to the places that they needed to go. Economic Development started issuing disaster loans. I think it was around $105,000 to local businesses. Harrisonburg Department of Public Transportation eliminated fares for their riders. Now, we also provided some increased cleaning of our buses. They changed how many passengers that they would allow on any bus at any one time, so that we had the utmost safety of both the riders and the drivers of those buses at that time. March 24th, you did the first social distancing meeting for City Council. Next slide. There we go. On March 26th, we basically closed the municipal building and City Hall and many of the other buildings to the public. There are still some services where we still had to make arrangements, but for the most part, the buildings were closed to the public, and we recommended that there was interaction either through phone or through online services. This was actually a very long discussion that was had, and during this entire process, we continued 2 meetings a week with city leadership to discuss where everyone was at, what everyone's needs were. They were sharing what their concerns from their staff were related to how we were functioning, and we were trying to find ways to make it more comfortable for them with this environment as we moved along. As Councilmember Jones had said earlier, you know, it's a large time of fear, and that's true for a lot of people related to any sort of outbreak like this. And so we were trying to find ways to curb this. The one thing that we needed to do was figure out a way to deal with the homeless because Open Doors' normal season was getting ready to end. They normally ended around the end of March. And the expectation was that they were going to continue to operate for at least 3 more months, but they didn't have a place to do it. JMU stepped up, and based on an agreement between the city of Harrisonburg and JMU and Open Doors, we started housing Open Doors' program, which involves night dinner and shelter at Godwin Hall at JMU. City Transportation picks up the homeless at the bus stop at Roses and drives them out there in the evenings, drops them off. Actually, the one thing that we have done ever since it opened up at Godwin Hall is the Suitcase Clinic, which is a local group of medical providers who volunteered to help take care of the homeless. They screen every homeless person that comes into that shelter to make sure that they don't have any signs or symptoms related to COVID-19. And actually, they do that for any illness overall, but they were doing it now instead of once a week. Once we started going into Godwin Hall, they did it every night. And so they would take their temperatures, they would talk to them, see how they're currently feeling, and then if anyone met the criteria, they would send them to the hospital where they could be further evaluated. And that has been going on up through today, at least. So on March 30th, we closed the playgrounds to the public. One of the biggest concerns in some cases were the fact that people were still gathering in groups at playgrounds. The playground equipment wasn't cleaned. If you remember, national parks were having to close trails in the local areas. Madison County had to close several over the weekends because there were so many people on those trails, they were not able to social distance. And so they took the next step of closing the playgrounds. Next slide. On March 29th, the Commonwealth of Virginia changed some of their standards on how they were reporting information, specifically to the public system access points. The intent was to provide an increased level of safety for first responders. And with that, they were able to give us more information than just a number on a daily count. And at this point, and this is off the top of my head, I think we had about 8 cases just before March 31st. And when we started getting the increased information, we started to see some trending based on some of the information we were getting. And we had to talk with Dr. Cornegay, and she agreed that she had seen similar trending. And in talking with her, talking with the city leadership, we wanted to start focusing our messaging to get it out to parts of the community that may not get information from us through the normal avenues. Often we put things out through social media, we put it out through press releases to the media, we talk about it on our website, we talk about it through city council, but not all of our citizens get their information that way. And so we wanted to start to push that message out in different avenues. So that was where we started with those things. And we started with some flyers that we were going to get out. We started with some reverse phone calls that we did through the public school system as well as through public utilities. We also know that because of the diverse nature of the city, we needed to actually get it translated into many different languages other than just English. Currently, most of the things that we send out is translated into 5 languages, which covers most of the city population, but still not all of them. And so we started doing that. We also started noticing that maybe it would help if we worked with some of the local businesses to help get the word to their employees. And so on April 6th, we actually had a conference call with the Central Shenandoah Health District, the county, and the city to talk about pushing information specifically to the poultry industries because of the size of the industry in the area to their employees about the importance of social distancing, about the importance of hand washing, and how to deal with that in this kind of environment. On April 12th, we did get notified from the Central Shenandoah Health District that there was a outbreak here in the city of Harrisonburg within a long-term care facility. The initial notification was related to the fact that they had 5 patients that were tested. Of the 5, 4 came back positive. That is actually normally how outbreaks were actually handled across the state when it came to long-term care facilities. Because of the number that came back positive, they started making some assumptions based on signs and symptoms of residents of that long-term care facility, as well as those positive tests of the number of patients that could be positive for COVID-19. The medical director for the facility talked about the fact that he felt that over the next several days they were going to have a lot of patients that need to be transported from the facility to the hospital. The city actually partnered with the Harrisonburg Rescue Squad. We actually provided 2 ambulances for probably the next 10 days that was available to that facility 24 hours a day, 7 days a week, specifically designed to transport those patients that they needed out to be transported to the hospital. In addition to transporting patients, we also did some shuttling of emergency medications. The long-term care facility's main headquarters is in North Carolina. That meant that often if they needed medication, it was being shipped from North Carolina and was taking over 4 hours to get to the facility. Some of that medication was needed in less than an hour, and so we helped facilitate transport from the hospital to the facility of those medications and a couple of medical equipment for them. The one thing that Dr. Cornegay wanted to do with the help of Dr. Shank, who is the medical director, was they really wanted to narrow down how many people in that facility are actually sick. And that would help them provide a plan on how to isolate those people who are sick and quarantine those people who are not sick. Because if you don't know 100% of what's going on, it's hard to control that crossover. Many patients will initially present with no symptoms for COVID-19, so you can't just make that assumption that they do or don't have it, especially in a long-term care facility. So they made the decision they were going to test 100% of the residents in that facility. They also tested 100% of the staff. I know for sure Dr. Cornegay has told me that this was the first time it was done this way in this district, and it's actually probably one of the first times that it was done statewide. And in fact, this was done on Wednesday, the 15th. The governor that Friday, the 17th, and I may be off on my days or on the dates, but the governor actually announced that that was the initiative that they were going to do at every long-term care facility when they thought there was an outbreak. And so when those test results came back, that caused a very large spike on the city of Harrisonburg's numbers. And in fact, based on our numbers, on April 15th, we actually got 90 new cases that one day. Now, not all of those cases were specifically related to the long-term care facility, but a majority of those cases were related to that one site. And actually, over the next several days, we still also got a few more related to that. We started daily conference calls between the long-term care facility, the city, the county, and the Central Shenandoah Health District, as well as BDH, and actually the main corporation for that long-term care facility. Basically talking about what their current status was and what their needs were to help manage that facility. Things like increased oxygen concentrators. A facility like that normally would not have the number that they normally needed. And in fact, I think at one day they had to bring in 40 additional oxygen concentrators to that facility, and they were actually there within 24 hours. They changed the type of nasal cannula that provided oxygen. Normally, nasal cannulas are what you would often see with people who have some sort of respiratory disease, long-term illness. It has two prongs in your nose to provide you a low level of oxygen. The problem is these patients with COVID-19 require a lot more oxygen than is normally expected on these kind of patients. And so they brought in specialized nasal cannulas that could actually provide increased oxygen to these patients without actually changing the amount of oxygen being delivered. So we were working through those things on a daily conference call. Next slide, please. One of the questions that has come out is during all of this was why more and more information couldn't be released to the public related to this. And one of the things is we were working on messaging from our standpoint that we got from BDH was there's actually a Virginia privacy law to protect the patients. Patients don't necessarily want everything about their personal lives released to the public. And so because of that, this state law that's in place limits the amount of information that the Virginia Department of Health is allowed to release to the public without their permission. And based on that code, a person actually means an individual, corporation, partnership, or other entity. So it not only extends to just the patient, but also to those businesses and corporations where these patients are at. And so communications became very complicated because not only do you have Virginia Department of Health and you have the city of Harrisonburg, but you also had the facility, and everyone had to coordinate what could be said and what they didn't want said based on patient's condition and what how they were able to communicate with the family. When you're talking about a nursing home, a long-term care facility of that size, the biggest problem they had so many staff who were sick. Normally, who would contact the family were those people who worked there, but they weren't working because they were sick. So they had to rely on people in North Carolina, where their main corporation was, to relay that information. And so communication became a delayed process, and it became a problem with some of the family members because now they have someone who doesn't know their loved one at this home calling them with information, and they couldn't answer, well, how are they doing right now, because they didn't know, they didn't see them. So that was a problem with communication that they have actually worked very hard to address. Next slide, please. As part of not only the outbreak here, but the continued trend throughout the city, we really wanted to work with the health district and with some targeting messaging. So, and just so you know, just before the 12th was Easter Sunday. We wanted to make sure we got some targeted messaging out before Easter occurred, because the one thing that we've noticed in other outbreaks that we've had here in the city, as well as across the country, is holidays cause a problem. People want to gather, they want to be together, and because of that, we really needed to do some targeted messaging stuff for that Easter Sunday. So I'll let Mr. Parks take over.
Thank you. Pam, you can go to the next slide, please. Good evening, Madam Mayor and City Council. I'm Mike Parks, City's Director of Communications. I'm going to talk a little bit about the messaging and community engagement efforts that we've undertaken throughout this process. So, one of the things that we started from the very beginning of this process in early March is we wanted to do as much of our vital messaging as possible in English, Spanish, and Arabic. So we know those are the main languages spoken here in Harrisonburg. So as often as possible, we would get all of our messaging in those languages. We worked with a state contract to make sure that we were able to translate that stuff professionally as quickly as possible, get it up onto our website and onto our social media pages. Our webmaster has done a great job creating not only probably now up to 200 posts about COVID-19 just on our main city Facebook page, but she's also created a lot of materials on our website, including a page just of multilingual information for our community to look through as needed. So we continue to share updates through those means, and we've worked on videos and radio PSAs and a number of other materials. Mayor Reed, Vice Mayor Romero, we appreciate everything you've done to help us get out a lot of that information as we try to reach as many people as possible. Next slide, please, Pam. So here's a few of the things that our different departments have been working on. One of the main things we wanted to do is get out messaging into the public and let people know what was going on. Parks and Rec has done a great job getting out signage as we have slowly closed different facilities, starting with our indoor facilities and then our playgrounds and some other venues like that. We've also put out signs, our tourism managers put out a number of signs urging people to shop local, be that through carryout or delivery or purchasing of gift cards that can be used later. And Public Works has put out some inspirational messaging. If you haven't seen it on Main Street, I urge you to take a look at it. And we've also worked very closely with all of our local media, which we really appreciate everything they've done to help get out updates to the community as we've released information as we get it. As Paul was saying, we've tried to increase the amount of languages that we are putting out information in. So in addition to English, Spanish, and Arabic, we added Russian and Swahili after speaking with some of our community partners and looking to see what would be the best options for us to use for reaching the community. That has included flyers that have gone in school lunches that HCPS is putting out to students. More than 5,000 bag lunches have had messaging from the city in 5 different languages. More than 8,000 flyers have been sent to homes throughout the city with messaging in 5 languages, and we are putting out some 5,000 door hangers neighborhood by neighborhood right now in 5 languages as well to make sure that we're reaching people through additional means other than our traditional media. Pam, please. And the community partners have been huge in our efforts to reach out to as many people as possible. HCPS has sent out text messages, voicemails, and emails to all parents that have signed up for communications from the school system using a message that we created, and they translated into a number of different languages. Amy Snyder in the city manager's office has created a coalition of some 70 local houses of worship, which is receiving our information and pushing it out to their congregations every week. Public Utilities Department has created a voicemail in English and Spanish that was mailed out to everyone that gets an email copy of their water bill. Our police department and our fire department have worked to put out flyers on vehicles throughout the city. They've also helped with putting out door hangers this past week. And obviously the community convoy, if you haven't had a chance to see it, has done a great job in helping reach some of our community members where they are. And there'll be another one tomorrow at 2 o'clock. And then Parks and Rec has recently started offering a number of virtual events that you can take part in through our website and our social media page. We had a free concert the other night. We're going to continue to have videos that people can take part in as we continue to try to offer our core services without being able to really reach you face to face. Next slide, please. Our Economic Development Department and City Council, I will send you a list of much more detailed information because it's too much to fit on the slide of everything economic development is doing right now to help our residents. As we mentioned earlier, we created a disaster impact loan program that put out more than $100,000 to local businesses, and they are doing a number of other things, working with local task force, with HDR, with the Chamber of Commerce to reach as many businesses as possible, and they continue to do so. Public transit, in addition to providing The main 6 city routes that we continue to offer, we're also still offering paratransit. We are doing a lot to protect our riders and our staff as we operate those buses. And our public transportation, as Paul said, is continuing to provide routes for individuals who are homeless to Godwin in the evenings. Community development, we have been working on a program called LLAMA, which allows you to do your permitting online without having to come to the office. As this began to progress, we knew that we needed to push that out a little bit earlier than we were intending, and community development worked hard to make sure that that was available for our community, and that's been a great success. And as you know, Public Utilities has pledged not to disconnect anyone's water service at this time, and we also recently took a vote about late fees as well, as we're trying to help as many of our residents and businesses as possible that have been impacted. And then also the recycling center. Though the recycling convenience center is closed, we continue to offer the mobile units, and when possible, we're bringing out extra capacity to those unit locations throughout the week. Yeah. I'm going to turn it back over. Thank you.
Part of all of this was to actually get you to where we are today and some of why we are where we are. This is a graph of both Harrisonburg and Rockingham County's active versus non-active cases. As of yesterday, there are 392 cases here in the city of Harrisonburg. Of those, 360 of them are active. Now, I work with the Central Shenandoah Health District to give you a definition of active versus non-active. One of the things that a lot of people have said is, why doesn't people tell us why we don't know how many people have recovered? And the reason is we actually don't test for that often. Very rarely are they giving a second test to say that the person no longer has COVID-19. The thought process is often that it's a 14-day cycle. We wanted to be a little bit extra lenient with that. So what we basically did is we've been tracking all of our notifications on a 21-day cycle. So basically what happens is when we get notified of a case, I flag it for 21 days from now, and at the 21-day mark, we make it non-active. And that way we can see where we are as a community with how many active cases there are. So as of yesterday, we had 360 active cases here in the city of Harrisonburg. Rockingham County, as of yesterday, has 208 208 cases. They have 190 active cases, which means combined, because of the community that we have at 600 cases, with 551 of them being active. If you go to the next slide. What this does is this shows you the daily count of new cases as they come into the city of Harrisonburg. And actually, I've worked very closely with the Central Shenandoah Health District to maintain these numbers, because they may get cases several days later than what the actual day is. So I have to give credit to both Dr. Cornegay and to Hillary Cronin, who I probably spend 2 evenings a week with, confirming our numbers for our daily count, because I know it's important for you all to see how we progress. And what the numbers tell me more is where we are within the cycle of what a wave is for a pandemic. We were first notified on March 12th, and so you'll notice on the far left, that's March 12th, and you can see the progression that up until around the 1st of April, for the most part, we were receiving 1 or 2 cases a day. And you can see that big spike there on April 15th. That is the biggest spike that we've had in the city of Harrisonburg, had 90 cases for that one day. And you can see for the remainder of it, it has stayed below 40 cases for both combined Harrisonburg and Rockingham County. So you understand the colors. Blue is the city of Harrisonburg and orange is Rockingham County. Next slide. One of the main sites that people often go to is Johns Hopkins University's dashboard for COVID-19 that talks about how the disease progresses through the world. And when you look on the bottom right-hand side, at least up until recently, they showed the accumulative cases per day. And that's in essence what this is this shows how our cases have spread since the disease has started. And as you can see here on April 27th, we're at 600 cases. Now, this is how many positive cases that we've had come in. And it only gives you a small picture of what is going on and what we're doing and how the community is responding to our actions. And so something, as we started to look at this and see what we're doing, we I don't want to say we made a discovery, but we had some things that at least show some positive light at the end of the tunnel. For the next slide, please. So this is just the city of Harrisonburg, and just as the new cases are coming in. And when you have 90 cases in one day, it's hard not to go down from that with a community this size. But if you'll notice, when we saw it, we could start to see a trend. Next slide. So one of the things with a community our size, there we go, a small outbreak, or in this case, a moderate-sized outbreak, can cause a very skewing of the numbers based on what our community is really doing. So what this slide actually shows is this actually removes that one outbreak from our numbers. And the reason we wanted to do that is we wanted to see how the community was responding to our actions and what some key markers were related to what we were doing. So as you notice on the far left, you can see that initial case there on March 12th. And that star represents where we actually had enough cases that we could start to see trends and things that needed to be responded to. And at that time, tests were actually coming back at about a 9 to 10 day rate. So 9 to 10 days from when they were being tested, the tests were coming back just because of the number of tests that the state was doing, but the small amount that they were allowed to process at one time. And so we started to focus our messaging at that time where that star is, and you can see cases started going up, but that would actually make sense because the tests were still coming back at a slower rate. We were concerned, though, as our cases continue to grow and we start to head towards Easter, that we were going to have a much larger spike right after Easter. And you can actually see once you remove that long-term care facility from those numbers, our actually peak day was April 17th, which actually just happens to be 5 days past Easter. And the mean time for signs and symptoms to show up, which is when someone would often go and be seen and actually get tested, is 5 to 7 days. So that's what we would expect when you have groupings of people coming together during that holiday season, is you would expect to see a spike soon after that. The light at the end of the tunnel, we hope at least, is you can see from April 17th through yesterday a continued downward trend in our cases, to the point that actually yesterday we only had 6 new cases. And this is, probably evidence of the messaging that we're getting to our community, is it's being spread more and more out there, and more people are understanding what they need to do to decrease the spread of this disease. Now, we are still early in the pandemic. For those of you who don't know, a pandemic is often considered in 3 waves. And you're hearing more and more talk about that second wave. And the hope is you actually get a vaccine to sort of stop those waves. And those waves can be semi-predicted based on the number of cases that are coming in, the hospitalizations, the deaths associated with it, and then how we do our social distancing and basically our standards. And that's why there's a lot of conversation with the governor and with the governors across the country about when do we open back up for business. And depending on where you fall on that spectrum, depends on that wave. The longer that we social distance and do the current measures, the farther out it pushes those waves that we have to deal with. So we're still early in this. We're still only at the end of April. But I can say at least what this appears for the last 10 days is that we're at least making a positive impact on the community by decreasing the number of positive cases that are coming in. I think if you look at the number of deaths outside of the outbreak facility, which is a very high-risk population, we've been very fortunate as a community based on the number of cases we have. We've also had not an overabundance of strain on the healthcare system related to the number of patients needing ventilators in the hospital and things like that. So that's also been very beneficial for the community. I'm now going to turn it over to Dr. Cornegay, who's going to talk a little bit about the Central San Diego Health District's response.
Thank you very much for inviting me to attend the council meeting this evening. Our public health mission to protect the health and promote the well-being of all people in Virginia really requires close collaboration with all of our community partners And these collaborative efforts are even more critical in our response to COVID-19. As Paul pointed out and highlighted in his presentation, both the city and the health district began a collective response to the public health emergency even weeks before we saw the first case in Harrisonburg. One of our core public health responsibilities is disease prevention, control, and surveillance. And our local health departments regularly respond to disease outbreaks. The challenge of COVID-19 is really not only the scope of the disease. As you heard, we have over 600 positive cases in the district, but also the fact that we don't have any kind of history with this new virus. For disease outbreaks, different bacteria and viruses that we have a history with, we actually have kind of a roadmap. We know historic knowledge about the organisms, and that allows us to predict the course of the outbreak, track the spread of the disease, and provide treatment and prevention recommendations. In the case of novel coronavirus, we're really building knowledge even as we respond to the pandemic, and we currently, unfortunately, don't have any treatments or vaccines to stop transmission. So due to this lack of medical countermeasures, we're really left with all of the public responses of social distancing, hand washing, respiratory etiquette, decontamination of surfaces, and masking strategies. And those are our main tools to decrease the spread of the virus and really flatten out that epidemiologic curve. Paul has been nice enough to provide epidemiology support for the city, and we really appreciate that. And that allows us really to track the trajectory of the outbreak. As you can see by Paul's graph, it shows the number of cases by test date or date of onset of symptoms against time. And really what we're trying to do is, rather than have a really sharp upward curve, is to really flatten out that curve and decrease the number of cases, spread them out over time. What that allows us to do is a couple things. One is it prevents our healthcare systems from being overwhelmed, and it also buys us time to hopefully find treatment regimens and preventive measures such as vaccines. One of the challenges of this response, as opposed to other disease outbreaks, has really been not only the volume of cases, but the desire in the public for a lot of real-time reporting. And we totally understand that, but it's a little unique in the work that we typically do day in and day out. Really, with any outbreak, our number one priority is our public health response, and that's case identification and contact tracing. So those are the keys to stopping transmission of COVID. When we get a positive report into the health department, we open a case investigation. We have one of our public health professionals call the person who's affected, learn a lot about their symptoms, and learn the course of their disease, learn a lot about them to build that demographic information that we're sharing on the website, and also to develop a contact list. In our districts, we have public health nurses, epidemiologists, and other high-level professionals doing those case investigations. And in a multicultural community like Harrisonburg and Rockingham, sometimes that can be challenged by need for translation services that can, make the case investigations, last an hour or more. The patient is contacted, like I said, by the public health professionals. We develop this data, and then we make recommendations for them in terms of isolation. We have a team that does contact investigation, and they contact all of the contacts to the case patients and make quarantine recommendations. If those patients, hopefully they're not having any symptoms, and they would be quarantined for 14 days. If they are symptomatic, they also often fall into the presumptive case category, and we kind of walk them through isolation regimens and whether they need medical attention. The contacts, we actually do daily monitoring. We have a monitoring team to just check in once a day to see whether these contacts have developed any symptoms. One of the other things that we do, and Paul kind of alluded to this, is we provide care kits to the case patients. And those care kits include things like thermometers, masks, gloves, other household decontamination measures, and we've provided probably at least 40 to 50 of those throughout the area. If people need it, we've also been providing food boxes. We've partnered with some food pantries, and we're able to provide some food to meet the needs of people for up to 14 days of quarantine. The work on the case investigations, these contact investigations, and meeting the needs of all the people in isolation and quarantine really takes up the majority of our workday. In addition to this, we've also stood up a COVID hotline. That's 855-949-8378, and that operates 5 days a week. We were averaging about 400 or more calls a week when things first started. We've tapered down a little bit to about 300 or so calls a week. We also coordinate state testing throughout the district, provide education, personal protective equipment, and also rapid response testing in high-risk congregate settings, such as a nursing home outbreak. The data entry that feeds our outfacing website is really completed after all of those actions take place. So sometimes it's actually completed late into the night. You know, some of our epidemiologists have been at the office 11 or 12 o'clock at night putting data in that kind of feeds that public outfacing website. So that causes kind of an inherent data lag. One of the other challenges, I think, in putting context around the numbers of cases in a locality is really the differences in testing rates throughout the district and really throughout the state. The more tests that are obtained, the higher the case count is going to be. Among the 5 cities and the 5 counties that comprise Central Shenandoah Health District, about 31% of all tests performed were in Harrisonburg City, and Harrisonburg and Rockingham County together account for about 59% of the tests performed in the district. So the testing volume in this area has been high, which is actually good. That's what we're trying to get to, an increased testing volume throughout the district and throughout the state. In public health, one of the things we try to do with all of our work is really see it through a health equity lens. And we have been collecting race and ethnicity data that have been reported on the public website. But the data throughout the state has been somewhat incomplete over the course of time. It is getting more robust, and we're trying to build that out in a better way. As of April 27th, state data showed that about 34% of cases were Caucasian, 15% were other, 18% were Black or African American, and then 33% were not reported. In our health district, we did note a predominance of folks in the Harrisonburg and Rockingham area who had English as a second language. We're using the translator line quite a bit. And when we break down the data a little bit more within our district, up to 37% of Harrisonburg City cases are Hispanic or Latino, and up to 32% in Rockingham County are Hispanic or Latino. And those numbers may be a little bit underestimated. The people who are at highest risk for severe COVID disease are persons over the age of 65, and those with chronic medical conditions, including diabetes, hypertension, and heart disease. When you combine these risks with the spread of infection in close congregate settings, one of our ongoing concerns for COVID outbreaks is long-term care facilities. So in Harrisonburg, the health department responded to a large outbreak at Accordius, a nursing home in Harrisonburg. The response to this outbreak included sending a rapid response team to the facility who performed state lab testing. As Paul pointed out, 4 out of those 5 initial tests were positive for COVID. We immediately began an outbreak investigation, working directly with the facility on infection control and mitigation strategies. But as symptomatic patient counts escalated, the health department partnered with University of Virginia to provide a point prevalence survey. We went in and basically tested as many patients and as many staff members on site who would consent to testing. Results revealed 86 positive tests for residents, which was about a 96% infectivity rate, about 20 positive tests for staff. So about 106 of the tests reported for Harrisonburg are due to this one large outbreak. The health department coordinated efforts with multiple partners, including the city and county EMS, hospital, Northwest Regional Healthcare Coalition, and the Medical Reserve Corps to meet staffing, equipment, and emergency transportation needs related to the outbreak. This coordinated response really ensured that the needs of the patients and the facility were met. The PPE needs of the staff were also met, and neither the EMS system nor the hospital system were overwhelmed with transports or admissions, as there was and continues to be close communication, as Paul talked about, and coordination among all of these healthcare providers. Since social distancing is our primary strategy to decreasing transmission of COVID, we tend to see more cases of COVID in settings where social distancing is difficult. This can include areas with high population densities, congregate settings like jails and long-term care facilities, and crowded, closely spaced housing. Many non-essential businesses are closed in order to maintain social distancing, and many essential businesses have tried to incorporate telework options to support social distancing. Unfortunately, not all essential businesses can support teleworking, and they really worked hard to try to maximize social distancing while continuing to operate with an on-site workforce. One of the major industries in our area, as we know, is the poultry industry, with 6 plants that operate as essential businesses to support the regional and national food supply. The health departments work with the Virginia Poultry Foundation and all of the plants to provide ongoing guidance on mitigation strategies, case investigations, contact tracing, and best practices for reducing disease transmission. We're working with our statewide partners to address outbreaks within the poultry industry and to determine the best strategies for protecting the health of employees in the industry, which is our number one concern. This includes close monitoring of cases associated with each facility, working with the facilities to identify additional mitigation efforts to decrease the transmission of disease. The governor has convened a health equity work group to explicitly address the disproportionate impact of COVID-19 on Black, Latino, and Indigenous populations and other vulnerable populations. And the VDH lead for this group is the Office of Health Equity. Central Shenandoah Health District has worked with the Office of Health Equity to identify census tract data of persons at high risk for COVID based on age and health status, and narrowed further by social factors of low household incomes and high household densities. I had a presentation today that showed an overview of that information as it pertains to Harrisonburg and Rockingham County, and we hope that this data will allow us to target efforts at neighborhoods at most risk. So we'll be meeting again in the coming days to try to develop strategies to use that information, to use information that Paul has provided via heat maps of areas of high preponderance of COVID disease to really do strategic targeting of neighborhoods that need our help, be it prevention or testing or education. Finally, I'll just say a few words about data sharing, because I know that's been a big concern. I think one of the things that really makes public health successful in disease investigation is the protection of patient privacy. Our public reporting continues always to balance the needs for actionable data with concerns for individual patient privacy. So in regards to the Accordius outbreak, we really worked hard to try to gain needed permission to be able to share both the name of the facility as well as case numbers and deaths associated with the facilities, but that just took some time. And looking at the change in case numbers on the website, it's also important to remember that regardless of what numbers you're seeing on the website, there is widespread community transmission of COVID throughout Virginia. So regardless of those day-to-day changes, really we have to be preaching the same public health message that we need to maintain social distancing, hygiene, and masking, all of those public health messages until we feel like we're at a point where we can kind of scale those things back. I really appreciate the opportunity to speak with you, and I really appreciate your partnership in responding to the COVID-19 pandemic. You have a wonderful team, and they're a great asset to our public health efforts. So thank you very much.